Generally, how is the pandemic impacting mental health from your perspective as a clinician and what you're observing and just as a member of the African heritage community?
I'll start by thanking you for inviting me to be here. I'm honored to talk about this. So generally, the pandemic has brought in a lot of anxiety. People are struggling to survive. It has also brought in economic hardship. Statistically, the African American and other communities of color have been hit hard economically from this pandemic. These same groups have been hit hard statistically with the number of COVID cases and the number of deaths resulting from COVID. So this alone have raised a lot of anxiety and a lot of stress on communities of color, on minority communities as well. The level of stress has been increased, which would exacerbate already existing mental health conditions, depression, anxiety, and also with the enormous amount of stress in our community from the pandemic and other issues that have come across as a result of the pandemic, has the potential of triggering mental health issues that people were predisposed of. In my practice, I specifically work with teenagers, and the way it's impacted this population is that they are isolated from their friends, and we all know teenage years are the stage where they are more apt to associate with friends than their family members, because that's just the stage in which they are. And being cut off from their friends has also increased that level of anxiety, depression, and a lot of suicide thoughts. I don't know many teenagers of color or other people of color who've committed suicide in this period, but definitely there's been an increase of suicide thoughts, increase in depression, increase in anxiety, and also with isolation comes alcoholism, drug use, relationship issues at home, just because of the stress brought about by the pandemic.
All of us do have either family members who are teenagers or nephews or nieces or neighbors. How can we help support these teens, in terms of their mental health and well-being?
First and foremost, we need to be able to have an avenue where teenagers could be able to express themselves and talk. Most of them at this point are tending to isolate because they are not out going to school, interacting with their friends. And so they're more apt to isolate. And we know with isolation comes depression, comes anxiety, and a host of other mental health issues. So really providing a space for communication at a family level, because we are all isolating with our family members right now, where teenagers or family members, everybody could feel vulnerable to express how they're feeling, will be a start. As we are isolated, making sure that we are utilizing our technology, which would be phones, computers, Zoom. We are doing this over Zoom now, to check in with family members and to check in with teenagers and to talk to them. Also, I know it's cold here in the Northland, but it is important to get out there and get fresh air. We can still be out there, experience nature, and do things and still be able to socially distance ourselves. This would give healthy avenues or outlets for family members, teenagers, even the elderly to get out and kind of decompress from the stress.
So what I'm hearing you say is, we need to continue to engage, basically, with the teens themselves, even though they may have a tendency to isolate, but we should, create those opportunities for conversation, for socializing as a family. So creating those times and being intentional about doing that rather than just leaving them to isolate. What other ways can we, take care of ourselves mentally? So I believe those are, key things to do, getting out, getting some fresh air. Are there other ways we can help ourselves to be mentally well?
A component of driving stress in our community has been social networking. And so we all live in this era of social networking. We spend a lot of time on social network, on TV. And so being able to get yourself off of social network, intentionally create that space where you are off, and where that, because when you turn on the TV, what do you hear? Number of cases are rising, hospitals are getting filled, everything about our news these days is so depressing, which adds to the stress and adds to the fear that the pandemic itself has already brought. So being able to take time off from all the social networking and just pay attention to each other in the family is it's necessary, so that you don't get inundated by all the data that the news gives and all the cases that you see and all the number of deaths, because that just continuously reinforces our vulnerability and increases our stress, and that could wreak havoc on your mental health.
That is so true. What I'm hearing you say, Billy, is we need to filter what is coming in, because we can't just keep hearing this news over and over again and all the things that are going on. We have to just be intentional about guarding our mental well-being. That's probably the best way I can put it. So as the holidays are coming, we may know people who, maybe by themselves and we can't really be with them. Are there ways to also help them, support them, particularly the elderly?
I will tell this specifically to the African American community. Mental health continues to be a stigma, which is not being talked about at all. A lot of our elderly are isolated just by the fact that they are in a vulnerable category with the pandemic. They're less likely to leave their homes. They're less likely to socialize. So they're isolated. Yes, I agree. Being able to call mom, dad, grandma, great-grandma regularly on the phone and have conversations, and encouraging conversations that would lead them to talk about their mental state, because it's helpful for someone to just hear you talk. Picking up groceries for your grandparents, baking cookies together. Grandparents bake the best cookies. I'm being biased, but
of course they do.
And so being able to do best meals, being able to prepare meals virtually and tap into that wisdom of grandparents. Every Christmas or every holiday season, you prepare this meal. You are not here to prepare it. We won't be together. I'm going to do this, but could you join me and we can do this together? So there are still ways we can engage in these activities that brings light, that sheds light in the family during these seasons. We can still do them virtually. That's one way. And I'm also encouraging family members to adopt mindfulness practices, like meditating together, dancing together, deep breathing together, and really focusing on creating space and time to engage in mindfulness practices that are specifically designed to reduce stress. Whatever that is in your culture. Could be dance. In my family, we like to dance. So we do create a time to just drum and dance together, which helps distance also distract us from the stresses that are out there, and just focus on each other, focus on engaging in activities that are stress reducing. Goes a long way to help. And you can also do this virtually with grandma. Spoken word is a big thing in the African American community. So we can also engage in things like that. Figure out our own unique way of managing stress and of expressing ourselves. And so I want to add something real quick. It is not a weakness to acknowledge mental health. If for some reason you're feeling stressed out, reach out to your provider, reach out to if you don't have a mental health provider, there are resource lines to call, and you are feeling suicidal, if you are feeling super stressed, and that information I will provide it on the website as well, and for people to be able to look it up. Call the community mental health clinic, make an appointment, talk to a therapist. If the pastor is what works for you, talk to a pastor, be able to let it out, speak to your mental health, consult a psychiatrist. It is not a weakness to acknowledge that you have mental health. It's actually a strength. and taking care of it, it's very important in these stressful times.
Thank you so much for, for just adding that. That is so key. That is a key piece of information right there. Thank you so much.
You're welcome.
Yeah, well, thank you so much. So many tips, so many ways that we can help support others as well as help maintain our mental well-being ourselves. And key thing that I'm taking away from what you're saying is, we can get through this together. We don't have to do this by ourselves. Let's support one another. Let's be there for one another, and we certainly can get through this. And let's continue to have a conversation around mental health. Let's not shy away from it. It is what it is. It's a health situation. We have mental well-being. We need to engage, and we need to be supportive of one another. Thank you so much. This has been so enlightening.
Yes. Absolutely.